assuming that everything else is fine. We're so glad that everyone is here today. And we are so glad that you're able to join us this morning. So thank you so much for being here, Dr. Matthews. I'm here this morning to introduce Dr. Matthews. Dr. Allison Matthews serves as the Executive Director of Gilead Campus Faith Coordinating Center and a Research Fellow in Faith and Health in the School of Divinity at Wake Forest University. She specializes in integrating technology, social marketing, community engagement, and social science to examine the intersections of race, class, gender, sexuality, religiosity, and HIV-related stigma. Along with Kimberly Knight, she co-founded HIV Cure Research Day in North Carolina, which now takes place every December 14th. Her most recent work focuses on engaging communities in COVID-19 related studies to raise awareness about COVID-19 vaccines, connect people with COVID-19 to wraparound services, and better understand the impact of COVID-19 pandemic on underserved communities. She earned her BA in sociology here at Howard University and her MA and PhD in sociology from UNC Chapel Hill. We welcome Dr. Matthews today. Thank you so much.
Hello, thank you so much for having me. I'm beyond excited to be speaking at my alma mater, Howard University. Today I'm going to be talking to you about the work that we're doing at the Faith Coordinating Center to address HIV-related stigma in faith communities. Our main kind of motto and slogan is transforming the story with the Faith Coordinating Center. And really, we think about that as an opportunity for us to engage with faith leaders, talking about, breaking that silence around HIV in faith communities. There's been, over the last 40 years, of the epidemic, we've had quite a bit of an antagonistic relationship with faith communities in the United States around HIV. And largely because of the, homophobic and transphobic messaging. And that is not to say that there are not faith communities that have been doing the work. There are a lot of faith communities that, in the early days of the epidemic, stepped up and supported people living with HIV, supported those who were in hospice care and dying from complications with AIDS. And yet, over the years, the kind of support from the faith community has started to wane, partially because people have associated HIV with sexual orientation or with quote unquote sinful behavioral choices. And a lot of that is really tied to our interpretation of the sacred text. And so with the Faith Coordinating Center, we work to address that HIV-related stigma in multiple ways that I will go into in this presentation. But there are some opportunities beyond just the Faith Coordinating Center that faith communities can implement to address HIV stigma, such as supporting candid institutional and community dialogue about sexual and reproductive health. We've seen all how important it has been for us to talk about sexual and reproductive health in this last year, as we've lost blanket rights to abortion access. Hosting HIV discussions in settings inside and outside of the faith gathering space, having a social justice ministry. I think a lot of times when we think about HIV ministry, a lot of people think that you can only talk about HIV, but really HIV is a social justice issue. And so it does seem appropriate that it could either be in a health ministry or a part of a larger social justice ministry, which is sort of the new trend in faith communities. Using social media outlets to engage people about prevention and education. During COVID, we have seen more and more faith communities get online And so that is a new opportunity for us to be able to engage faith communities about health messages, using social media and traditional media like TV, radio, newspaper, magazines, and blogs. Working with other faith leaders at HIV campaigns, and also having relationship and conversations with other interfaith leaders. So why are we talking about faith spaces in 2022? There's 83% of adults in the South say religion is important in their lives. Among African Americans, that's of course just as high. And also that faith is very important among people living with HIV. It oftentimes helps them deal with stigma. It helps them deal with their diagnosis, and it's oftentimes a source of support for them. There's an estimate of about 10,000 churches in the United States that have people living with HIV as members. And also over the past decade, the attitudes towards same-sex relationships have improved, especially among Black church-going people. It's increased from 30% approval rating to about 57% approval rating overall. That's according to Pew Research Center. And even among millennial and Gen Z, the approval rating is in the 70s and 80%. So the time is now for us to re-engage and have conversations, because there's a lot of tools that exist to in the HIV epidemic. We have prevention medication, we have treatment medications, and we're working on finding a cure for HIV, and vaccines for HIV. And so we have the medical tools to end the epidemic, but we really need to re-engage with communities to address the stigma around HIV and increase access to those tools. So the Faith Coordinating Center, our vision is to transform that story about HIV in faith communities. We want to challenge the stigmatizing faith-based narratives about people living with HIV and those who are vulnerable to the disease. This is our staff. We have grown over the past year and a half. We've actually been in existence since January of 2021. We have a postdoctoral fellow and some amazing program managers and project managers that will talk about some of their projects. This is a part of a larger Compass initiative funded by Gilead Sciences. Gilead has committed $100 million over 10 years to support organizations working to address the HIV/AIDS epidemic in the Southern US. And so they are accomplishing that goal through multiple programs, like their corporate giving program, their medical education, through the AIDS View website, through direct grants, the Southern HIV Impact Fund, Community Investment Awards, and the 4 coordinating centers. So Wake Forest is one of 4 coordinating centers that does this work. Our values: we celebrate all faith traditions. We transform and eliminate HIV stigma, and we expand the capacity of faith communities. And we do that through grant making. We are tasked with granting out $1 million a year. And so last year, 2021, we granted funding to 17 organizations. This cohort, 2022 to 23, we granted money to 18 organizations 14 organizations and 8 artists. And then we, next year we'll have another round of funding. With our grantees and with the larger community, we host trainings. All of them are online and via Zoom. And we have a listserv that you can sign up for to be a part and learn about the trainings. We also have a lot of trainings that are on our YouTube channel that in case you missed them or want to go back and hear about them. We also do a lot of work around storytelling and communications. And so, like I mentioned, my background in social marketing and communications and sociology has really informed our ability to create communication materials and engage with the media to get the message out there about HIV and faith. So a lot of our trainings cover topics around HIV in the South, faith-based capacity building, talking about sexuality and sexuality in the church. We do skills-based workshops on media, how to use media in marketing, how to dive deeper into the Bible and other sacred texts, to better understand how we can not only better understand the sacred text, but also to create tools for faith leaders to be able to put them into their sermons and into their community programming, to help shape their theological understanding. And this comes from divinity scholars, people who are scholars in and experts in sacred texts who are leading these trainings. The different types of grants that we give out are the Faith Capacity Building Grant, and that, all of these grants range between $25,000 up to $150,000 to $200,000, depending on how many applicants and how many grants we want to give out. These are some of our awardees from 2021. Some notable organizations that I'd like to point out. Interfaith Youth Corps has a capacity building grant, and they work with, I want to say it's 20 historically Black colleges and universities and Hispanic serving universities, and they give out many grants to those campuses to implement curricular programming and to develop the leadership, the student leadership and interfaith leadership on campuses. We also have the AME Publishing House and Christian Theological Seminary and Samuel Durrett Proctor Conference, the North Carolina Council of Churches. All of those organizations have done a lot to implement conferences and trainings, ongoing trainings with faith leaders. So, if I were to estimate how many people and faith leaders these organizations reach within 1 year, it's around 2,000. So we're really proud of this work. Our 2022 grantees are, some of them, we have some repeat grantees and we have some new, a lot of these, grantees are in touch points from Texas, Florida, Georgia, Louisiana, Mississippi, North Carolina. And so we have a good representation across the US South. And we also added on an artist cohort. So we're working with 4 artists, and one is an artist in residence who will spend a month here in Winston-Salem, North Carolina, and doing a guest lecture at Wake Forest University to engage the artist community and create things like a documentary, a play, an artist installation, and other kinds of visual arts to engage people in conversation around HIV and faith. We also have some larger strategic partners. HM Health Wake Forest Baptist is a partner of ours, the U.S. HIV and AIDS Faith Coalition, which we're very grateful to be a part of. Old North State Medical Society, which is the second oldest Black-run medical society in North Carolina, gives us connection to health systems and Black medical providers. We also are part of the UNC Chapel Hill Center for AIDS Research, and we're very close partners with Balm and Gilead, who's also hosting their conference this week, Healthy Churches 2030. So, as I mentioned, we do a lot around engaging popular culture, engaging the media. And so some big examples that we have are partnering with Lil Nas X, whose freshman album, Montero, was directly addressing stigma around being gay, being Black and gay in the church and being rejected. And so we thought that it was a provocative, but also a perfect partnership for us to really engage conversation around this and to amplify the messages around HIV and faith. And so we partnered with him. We had a Compass Initiative colleague who was in his MTV Video Music Award performance, and he also helped raise over $500,000 for Black LGBT-led organizations in the South. and helped us amplify messages around HIV. In addition, we have developed a Faith Leader Toolkit that is available for download that gives really updated information on talking about HIV in faith communities. It has sample, litanies and Bible verses and sample ideas for sermons and other kinds of helpful tools for faith leaders who want to think about implementing that work in their communities. And that is also available online on our website, and also was published in Pause magazine. And we also, took advantage of the opportunity to engage the Baby, who is another rapper who said some homophobic, misogynistic, and anti-HIV messages at a hip hop concert in Miami. And so that made national news. And so we worked with GLAAD, which is a media organization that's also in partnership with Compass, to to do an open letter. There were about 250 organizations across the United States who signed on to that open letter. And we invited him to a closed meeting where he met with people living with HIV who educated him and also explained to him how his comments were hurtful and stigmatizing. Some of the examples of panel discussions and things that we've hosted. This one was a really powerful panel discussion that we had on Black sexuality, the church, and living faith. We also had a panel discussion on HIV Cure Research Day, which is December 14th, talking about healing the mind, body, and spirit, not just the medical approach to curing HIV, but how do we also integrate this into, how do we rethink the way that we talk about healing? A lot of times faith leaders, we say, pray to God and then God will heal you. Well, yes. And, taking proper medication and engaging and taking care of your health is also a form of healing that we can accomplish. So, combining those and reframing the way that we talk about healing. We also hosted a conference in Dallas called Proclamation at the Intersections, which was wonderful. And we have a lot of the workshops and the panel discussions, and all of that content is available on blackfaith.org. And so I'm actually going to talk to you a little bit about that initiative, Black Faith and HIV, and the blackfaith.org website. In addition to that, we're working to develop a national database of faith-based organizations that are doing HIV programming or who are open to and interested in getting more involved. And so we're doing that in partnership with AIDSview.org to create this faith-based service locator, so that when people log onto AIDSview, they will be able to find a faith-based organization in their area and search by zip code to be able to find them. And so we are still administering this survey, and we welcome you all to take the survey and to share it with your networks. We really want to get as many faith communities represented on this database as possible. And it's a $25 compensation for taking the survey. We have the HIV and Faith Ambassador Program that we have started in North Carolina. We have over 50 faith leaders and 10 medical providers from Old North State who are members of this initial cohort of ambassadors. And the ambassadors go through retreats where we're doing trainings and workshops with them. And we also have an online classroom where we have educational materials and assignments for them. And then they are required, tasked with implementing programming in their communities around HIV. And then we're working with them to evaluate the effectiveness of those programs. All of this work is now going to be under the umbrella of the Black Faith and HIV Initiative. This is a legacy of the NAACP's work where they did the Black Church in HIV. That was a very popular website and initiative that trained over 2,000 faith leaders in the United States. And so we are bringing it into 2022 and trying to engage faith leaders on on HIV and faith, but also we're creating self-paced online modules that people will be able to take. So say you can't attend one of our live sessions, you can still go onto blackfaith.org and sign up for a self-paced module, and where you can go through some of the content. We're going to have modules based on trauma and trauma-informed care, and faith-based trauma, on the basics of HIV. We're on how to use communications strategies to amplify your messages in your community, and how to do effective community engagement. And once you complete those modules, you'll actually get a certificate from Wake Forest School of Divinity. In addition to that, we're creating an online community to allow people to network with each other on the blackfaith.org website. And this is also where you'll be able to find all of our recordings and our resources that I've mentioned in this video, so that, as people, this will be this kind of clearinghouse for us to be able to highlight stories. If you are doing work in your community, we want to know about it. We want to be able to highlight your stories on the blackfaith.org website, and to, create an online community, and also an in-person kind of community and opportunities for engagement and building that network. So that concludes my presentation. I welcome your comments and questions. You can follow us on Faith Compass WFU on Facebook, Instagram, and Twitter. You could also follow Black Faith HIV, which is also on Facebook, Instagram, and Twitter. Thank you. Now I'm going to see if I have any questions. You can put the questions in the chat. So I saw one question that was asked earlier. One was, why can't we all just get along? Even though our views are different. And I know something that people ask me a lot. This one, why do you feel it has been difficult for the faith-based community to address stigma or even speak the words HIV? And I think this definitely speaks to, there's been an ongoing association of HIV with sexual orientation and with sexual immorality or immoral behavior. And that is unfortunately a major reason why faith leaders have not been willing to talk about HIV. Many are afraid that if they discuss HIV in their faith communities, that they would lose their congregation, that the congregation would leave. But I think that a lot of those attitudes are starting to shift as we've started to engage in conversations with faith leaders across the United States, and especially in North Carolina. I think it's been important for us, because we're in a divinity school, we're able to have conversations with these faith leaders from that theological perspective. And so we have biblical scholars, sacred text scholars, who are able to talk to them about this from that informed perspective, to talk about how, really the goal that God wants for us is to lead with compassion and love, right? And so no matter what a person's status is, we need to sorry, I'm trying to read questions and answer at the same time. No matter what a person's status is, we need to embrace them and love them, and not reject them. And so, of course, that's a process. Not all faith leaders are open to that conversation, but more and more are. So I have a question. Do your materials address stigma toward other communities, such as sex workers, people who use drugs, and HIV positive women? Yes, well, so our materials are more general. They don't necessarily talk about any specific community, but in our trainings and the conversations that we do talk about all of these different groups. And so now we're trying to be more intentional about having conversations about the specific needs and the specific experiences of each group, rather than just trying to lump them all into one conversation, because each one of them deserves their own conversation. You know, you can't, even within the LGBT community, you can't just talk about LGBT and Q all at once, right? We need to break it out. And so we've had intentional workshops where we have a trans person who's speaking, as a faith leader and speaking about their experience. We have women who are living with HIV who have also been on panels and spoken from their experience and led training. So yes, we are working to be intentional about that. Can you speak more about how a relationship with Lil Nas X helped leverage a connection with Black churches and understanding HIV? So, we have to be, we have to rethink the way that we think about Black churches. So a lot of people are no longer attending traditional church. And so our thought process with engaging with Lil Nas X was that we would use that partnership to actually engage people who are no longer attending church, who have left church, and who have similar experiences of rejection. And so, at the same time, we also have partnerships where we're engaging with a lot of faith leaders who are, trying to have conversation with their own congregations and with their, big names like Reverend William Barber and others who, we're working with to engage more traditional faith communities. But Lil Nas X was really a way for us to be able to engage with people who are no longer in church. I think that concludes my time. And so I really thank you all for your time, your energy, and for engaging with me. If you would like to get in contact with me, you can email me, Matthew, MATHEWA @wfu.edu, or you can email compass@wfu.edu, wakeforestuniversity.edu. Thank you.